Hi, my name's Zoe Palmer. I'm from Turin UK and I'm here to train you on how to use our Falls monitors. Each of our Falls monitors are powered by a 9-volt battery, which I understand you have on all your wards already. If your monitor does beep at you, like an intermittent beep, it just means that your battery needs changing. So in order to change your battery, just give it a shake and it'll fall out. Disconnect it there and then reconnect a new one. As you'll notice when you're reconnecting, there is a recess just on the inside of your monitor there. So can you please just ensure that when you're reconnecting your battery to tuck the black and red wires into the recess so that when you're placing your battery into the monitor, it will just slide in and out, no problems. And your back will slide on without any problems as well. At the bottom of your monitor then, we have two portals, one labelled nurse and one labelled pad. The portal that's labelled nurse, you don't need to worry about at this stage. That's where we can incorporate a paging system into the device. But the one labelled pad is where you'd connect your pad into. Each of your TABS monitors come with a wire carrier. The purpose of the wire carrier is to ensure that you can position your monitor either on, say, the side or the head of the chair, the head or a foot of a bed. I would always recommend to position them there, as if you place them on a side rail and you have a member of staff that will come along and they're unaware that they're there and they drop the side rails, this could mean that the wires may break, connectors may break, things like that. So I would always recommend when positioning them to make sure that they're on something stable. They can also be used on the back of commodes, wheelchairs, things like that. So when positioning your wire carrier then onto your monitor, I would always recommend that you keep the portals away from you and the writing upside down. When placing this on, it's best to always place it at an angle and you'll find it will slide into the grooves a lot easier. Okay? I recommend doing it this way with the portals away from you and the writing upside down, so that when you do go to hang your monitor, it's always hanging up the right way round. So if it is positioned, say, on a side of a chair and you have a patient with a drink, any spillages will then hopefully overflow. Once your monitor is ready to be positioned, either, say, on the chair or the bed, you will notice at the bottom, as I explained earlier, you have the portal label pad. So this is where we're going to connect either your seat pad or your bed pad. When positioning your bed pad, it's always best to position it so it's as far back into the chair as possible, so it's directly under your patient's bottom, as when it's under the further forward or, say, hanging over and it's positioned under the patient's legs, you will then have a lot of false alarms. So I always recommend to position it as far back in the chair under the patient's bottom as possible. As you will notice at the end of the cord on the pad, there's a connector. That connector is a bit like your BT connector that you will get at home. So as you can see there, you would have to push it down to release it. So when connecting it then, pop it into the portal that's labelled pad and listen for it to click. Once it's clicked in, you'll notice that to remove it then you need to press that down to take the cord out, okay? So we're going to connect our pad now. So we're going to position it on the side or the head of our chair. Your patient will then come along and they will sit on the pad. That initial beep is what you need to listen out for. That's letting you know that the pad has registered the patient and that it's been activated and your patient is now being monitored. If your patient then decides to stand up, you will hear that alarm. Hopefully the patient will hear that alarm and sit down, and if that is the case, it will then reset itself. If your patient doesn't sit back down, it will continue to alarm, and the only way that you will reset that alarm is by pulling out the magnetic fob and placing it back in, okay? Just like that. When using the bed pad, again, you would position it similar to the chair, obviously on the bed, but you would position it so it's on top of the mattress but underneath the sheet. And as you can see in that diagram below, you would position it again just directly under the patient's bottom, so as far back kind of on the bed under the patient's bottom that you can. When positioning it, always position it widthways as shown in the diagram as well. As you can see, the bed pad is a lot narrower than your hospital beds. So if you were to position it this way, you would notice that when your patient's rolling over, you would get a lot of false alarms. Whereas if you position it widthways across the bed, directly under the patient's bottom, the patient will just continue to roll onto the bed pad. When connecting your bed pad, you would, again, just the same as the chair pad, you would have the connector at the end and you would pop it into the portal that's labelled pad. Okay. With both your chair pad and your bed pad, they can be used up to 12 months. So they can be used from several times from patient to patient. But when you're moving them from patient to patient and after each use, you just make sure that you give them a good clean over. You can use any kind of medical wipes that you use on your wards, such as Clinell, things like that. Just make sure that you give them a good clean over. Your seat pads can be used under the pressure cushions. Works the same way. If you pop it on the chair, pop the pressure cushion on top. If your patient then goes to sit down and you don't hear that initial beep, it may be that the pressure cushion is too thick or the patient's too light and it just hasn't registered that patient. If that's the case, then remove the pad, disconnect it from the monitor and move to your cord and clip. In the same way with the bed pads, if your patient does suffer from pressure sores, if they're risk assessed and they're happy to lie flat in bed, the bed pads can actually be used under the shoulder blades as well. When using the bed pads, again, if your patient does suffer with pressure sores, if they're risk assessed and they're happy to lie flat, it can also be used under the shoulder blades. But if that's not the case, again, just remove the pad and go to your cord and clip. With your cord and clip then, at the end of this cord is the magnet, the same as your magnetic key fob. So you just place the magnet in the monitor as so, and then at the end of your cord, you have a clip. This is what you then attach to the patient's clothing. I would recommend when attaching it to the patient's clothing, do it either, say, on the back of their collar, back of their sleeve, back of their gown, something like that. I would also explain to the patient's relatives, friends, exactly what the cord is being used for. As you will notice, on the clip there's a little white plastic safety catch that's for. So as you notice, as that's moving freely there, you'll notice that that can move freely, so you can attach it to the patient's clothing. When attaching it, I would always recommend to gather up quite a bit of material to pop it in there first. Once the clip is then attached to the patient's clothing, you'll notice just on the inside of the clip there is a little bobble of metal. So once it's attached, what I want you to do is to move that white plastic safety catch onto the other side of that bobble of metal. Then you'll notice that then securely locks the clip to the patient's clothing so that it can't be removed. The idea is then that is attached to the patient's clothing so that when that patient attempts to stand up, it will pull the cord and it will alarm in exactly the same way as it would if a patient stood up from a seat pad or a bed pad. In order to remove the clip from the patient's clothing then, you would simply just push that safety catch back down again so it's moving freely, so you can then move that from the patient's clothing without any breakages. Here is our wall mount bracket then. Our wall mount bracket can be used as a permanent fixture in your bathroom. It does come with screw fixings, but as you'll notice, we do provide dual lock. It's kind of like an industrial Velcro to secure it to the wall in the bathroom. If you are asked to position a wall mount bracket, you would simply just peel the back off there and secure it to the wall. When positioning the monitor onto the wall mount bracket then, you'll notice you have the grooves there and the runners there, so you would simply just slide it on like that and listen to it click in so that you'll know that it is fastened in securely. So when positioning it then, positioning it kind of lower down about arm's length away, so that when you are using the cord and clip, you want it so there's not a lot of give in it. So the purpose of that is so that when your patient does attempt to stand up in the bathroom, it will pull straight out an alarm. Okay. When your patient is on a monitor in the toilet, it gives your patient that extra bit of dignity and you that bit of reassurance that your patient is being monitored. When you are then going to remove the monitor from the wall mount bracket, you would simply just press in the button at the bottom, slide it up and off, and that would still remain there as a permanent fixture in your bathroom. Another aspect of our TABS monitors that can be used is called the voice. So the voice is where you would record a message which would then be emitted from the monitor instead of you hearing that alarm. When using the voice, I think it's perfect for those patients where they just need a gentle reminder to sit down. So in fact, the alarm can be a bit unnecessary. It's great for if you have patients where there's a language barrier, so they speak a different language. So in that case, you could ask one of their friends or their relatives to actually record a message of what you want to ask them in their language, so that it helps them to understand more. It might be the fact that a patient might just actually feel quite comforted hearing a familiar voice. It's all about risk assessing your patients as individuals, because in controversy to that, it may be the fact that that patient actually wouldn't respond to a message. It might be quite distressing for them, it might be quite confusing for them, and in fact that they do need that alarm to give them that reminder to sit down. Okay, so when recording your message, I would always recommend that you go into a quiet room to do it. Just as the monitor will pick up background conversations and it will pick up background noise. When recording your message, keep it clear, keep it concise, because obviously when you think about it, that message is being replaced for an alarm. So you want to get to the point quite quickly with that. Also, when recording your message, you want to ensure that you're ready with what you want to say. You don't want any kind of hesitation being recorded on there, because obviously the longer that you hesitate with what you want to say, the more of a chance it gives that patient to fall. Luckily, with the monitors, you can record and delete as many times as you want to. So, of course, if you do go to record a message and you stumble on your words, or there is a hesitation and you're not happy with what you've just recorded, then you can delete it, start again. You can personalise your messages as well, so you can use their names when recording messages, which is fantastic. In order to record your messages then, simply remove the back of your monitor, as so. As you will see, there is a black button. That black button then you would press and hold down when recording your message. And it's also the button that if you want to delete a message, you just press it once rather than hold it down. You'll notice that there is 3 lines there, which is the microphone, so that's what you speak into when recording your message. And there is a red light, so when pressing the black button down and recording your message, the red light will come on to let you know that it is being recorded. I will then give you a simple demonstration of kind of what you might say when recording a message. So press the button, hold it down, red light will come on, speak into the microphone. And could you please sit down and use the nurse's call button? Thank you. So that when your pad is either connected or that is removed and your patient attempts to stand up and the magnet comes out of the monitor, you will then hear, "And could you please sit down and use the nurse's call button? Thank you." As you will notice, just after the message is emitted from the monitor, it will alarm anyway. So if your patient doesn't respond to that message and sits back down, or it's not reset by a member of staff straight away, it will alarm to ensure that you attend to your patient straight away. To delete your messages, you would just press the black button once and the message will be deleted. Always check when recording and deleting messages to make sure that it has recorded and it has deleted by pulling the magnet out of the monitor. So that brings us to the end of the training. Thank you very much for listening. If you do have any further questions or queries, don't hesitate to contact your senior member staff, your Falls lead nurse, or if you want to contact us, our company direct, you will find our contact details on the Falls page on your intranet. Thank you.